Can you do a hair transplant on someone with Afro-textured hair? So as a hair transplant surgeon, I've done many different cases, and I have done quite a few people with Afro-textured hair. And in this video, what I'm going to explain are some of the challenges, the differences, and what the expected results can be from people with Afro-textured hair. There's a lot to dive into, and there's a lot of different reasons why people with Afro-textured hair can actually have a more difficult procedure and get more hair loss in general. So first off, Afro-textured hair is very unique, both in structure, the shape, and the curve or the spirality that it has. Afro-textured hair is actually quite unique, both in the growth pattern, the growth rate, the thickness of the hair, and this can actually present some unique challenges that we as hair transplant or hair restoration surgeons need to face in order to achieve a good result. And if you're thinking about getting one for yourself, or if you're a hair transplant surgeon interested in how to do Afro hair texture, then you're going to need to take these factors into account because they directly impact how the grafts are extracted, sorted, how incisions are made, and how they're implanted. First off, let's talk about the curl pattern or the shape of the follicle itself. With Afro hair, it has what we call a helical or a spiral curl. What this means, a spiral curl means that you have many curls that go or sort of in a spiral above the skin, or you can have a helical curl where it's sort of one big curve coming out. But the problem with that is not only does it curve outside the skin, it also curves inside the skin as well. And this creates a really large problem when it comes to extracting these grafts, because for FUE, for example, we use a very small micro punch drill. And usually people with straighter, more vertical hair, we can sort of follow the angle that the hair is exiting the skin, follow that exact angle, and we'll be able to easily extract that graft. But for people with Afro hair, then actually you need to follow the curve, and you sort of have to angle your punch as it goes in, which means this graft can be easily transected. Transect is where you cut through the graft by accident when you're trying to extract, which means they're very, very fragile. You have to be really technically skilled, and you have to have a lot of experience in extracting Afro hair in order to successfully extract that graft. So that's the first challenge, right? Just following the curve. The second thing to note is that although people with Afro hair tend to have a higher density of follicular units, so more grafts available, actually they tend to have less hair in each graft. So for example, we separate grafts into singles, doubles, triples, and so on and so forth. This means that one graft or one follicle can grow one hair or two hairs or three hairs and so on and so forth. Now, typically in someone with a very good donor area with straight hair, you would see some singles, but you see primarily doubles, triples, or even more. But people with Afro hair, you very rarely see triples or more than that. You usually see primarily singles and doubles. So even though technically they might have a bit more grafts, actually they have a little bit less hair overall. But this is not too much of a problem usually, because Afro hair tends to be a lot thicker in general. So you don't need as many hairs in order to create the same level of density as someone with straight hair. So it's a bit of pros and cons. You have to take the good with the bad. Although less hair in general, it's thicker hair in general. So it sort of evens itself out. Some of the other differences when it comes to Afro hair is actually not really to do with the hair, but the skin itself. Because people with Afro hair also tend, surprisingly, to have Afro skin. And Afro skin is actually a lot thicker. It has a thicker dermis than people of other skin colors and other skin types. And so not only is the hair a bit more fragile because of the curve, there's a thicker skin to get through as well. So you need to put a little bit more force and a little bit more pressure. Combine this, the transection rates for extracting Afro hair are really high compared to people with straight vertical hair. So you need someone who's very, very good at extraction with a lot of experience to do that. Now, also, another thing is going to do with the aftercare. People with Afro descent tend to have a higher chance of having keloid or hypertrophic scarring after a surgery. And if you're not sure what that type of scarring is, essentially, when you have a cut in your hand or your arm or so, if there's a little bit of a bigger cut, you'll probably end up with a white line where that cut was. But in some cases, the scar tissue is overproduced. So you not only end up with that white line, but the scar itself actually overgrows scar tissue in that area so that the ending scar is even bigger than the initial wound itself. That can be called hypertrophic scarring. And in the worst cases, that is called keloid scarring. And so people with Afro descent tend to have higher rates and higher risk of that happening. And lastly, this actually is not a difference, but a lot of people think that Afro hair tends to grow slowly. This is not actually true. It tends to grow at the same rate as other types of hair, which is about 1 to 1.5 centimeters per month for the majority of people. The reason it appears to grow a bit more slowly is because of that curve, because of that curliness of the hair. So instead of going straight out from the skin, it tends to sort of curl up on the surface of the skin, and therefore doesn't look like it's growing as fast. But really, it's growing at the same speed as people with other types of hair. Now, whenever you're planning a hair transplant, understanding why you have hair loss in the first place is a crucial step for the eventual success of that procedure. And people with Afro hair do have a few more reasons compared to people with straighter vertical hair as to why they can experience hair loss. So one of the more common ones for I see in my daily practice is going to be something called traction alopecia. And what is traction alopecia? So let's break down the word. Traction meaning to pull or pulling, alopecia meaning hair loss. So traction alopecia is alopecia caused by pulling of the hair. And unfortunately, in a lot of African cultures or people of Afro descent in culture, it is quite common, especially when kids are young, for mothers or parents to do these really tight hairstyles where they really pull the hair quite hard from the skin. And so you have a super tight ponytail and really pull it all the way back. Or when people are having styles like dreadlocks, cornrows and so on, they tend to knit the hair together and they have a lot of traction pressure on that hair on the surface of the skin. If done over a long period of time, you can develop something called traction alopecia, which is when the hair simply stops growing or gets a lot weaker, a lot thinner in the areas where it was being pulled a lot, and you end up with hair loss in that way. That tends to usually present at the front of the hair. There's another cause for people with Afro-textured hair, and this one is actually more towards females. There is a condition called CCCA, which stands for Central Centrifugal Cicatricial Alopecia. It's a bit of a mouthful, but we just call it CCCA or triple CA. This is more common in actually females of Afro descent, and it's a pattern of hair loss that you see sort of spreading in a spiral around the crown, developing and starting to cover the whole head. This is a form of scarring alopecia, and scarring alopecia is when not only do you lose hair, but the skin where the hair was coming from is filled or replaced with a lot of scar tissue. And the problem with that is you can't really do a hair transplant in these patients because you can do the best job in the world. If there's a lot of scar tissue, then these grafts won't get a good enough blood supply after being implanted, and therefore they won't survive. In reality, you can still do this procedure to try and increase blood flow. You have to heavily temper expectations as to the density of that final result, because a lot of those grafts won't survive. But something sometimes is still better than nothing, especially if it's very obvious and really affecting someone's quality of life. But typically, in patients with scarring alopecia, you would not usually go ahead and do a procedure. Of course, there is the common cause, androgenic alopecia, the most common cause worldwide, and yes, it also affects people with Afro-textured hair. This is to do with the high levels of DHT, or not necessarily high levels of DHT, but DHT sensitivity of the follicles. High sensitivity to dihydrotestosterone, as we all know, does cause hair loss, especially in men who naturally have high levels of DHT. And this also affects people of every skin color, of every culture, of every ethnicity. And that's why it's the most common cause in the entire world. So just because it's a different type of hair doesn't mean it can't still suffer from a lot of the conditions that many other people suffer from. And another one, and this is less to do with disease, but more to do with lifestyle. People with Afro hair tend to use a little bit more harsher chemicals on their hair, especially females who are trying to straighten their hair. So they use straighteners or harsh straightening chemicals or hair dye and so on. And this can cause damage to the hair in the long term and also lead to hair loss. So to kind of sum up what we've spoken about at the moment, Afro hair, very, very curly, very, very thick and more sparse than people with straighter vertical hair, much more difficult to extract. So special considerations for surgery are first making sure you have a very experienced surgeon who knows how to transplant Afro-textured hair and how to extract Afro-textured hair. You'd also want to make sure that the entire surgical team is very experienced with this type of hair. So you want the technicians also involved to have done several cases of Afro hair before, because not only the extraction, but the implanting is also difficult as well. You can go for the same methods that everyone else uses, which is FUE, FUT, or DHI. All methods will work quite well, even in Afro-textured hair. However, there is a bit of a silver lining. It's not all negative, which is good. Because I mentioned earlier that Afro hair is a lot thicker, so therefore you can get away with lower graft counts because you don't need as many grafts when the hairs coming from those grafts are so thick. So for someone, let's say for example, we're doing a very large surgery, we're doing 3,000 grafts, for example, to cover an area, then in a person with Afro hair, you're doing about 2,000 grafts will still get you the same coverage and the same visible density afterwards. So you don't need to do as many grafts, you can sort of lower the graft numbers and still get a good result. And that is a benefit to having Afro-textured hair. Other than that, most of the transplant procedure is very similar. So the pricing and the costings exactly the same. The recovery timeline is also exactly the same. You would expect full results about 12 to 18 months later. The recovery techniques and what you need to do in the first couple of weeks and the first few months are all exactly the same. So there's no difference there at all. However, one unique thing that can happen is to do with the curves themselves. So when you implant, sometimes it's not always possible to implant the graft in the exact same orientation as it was previously. So you can get these random curl patterns. So the pattern of curl could actually change, and it might be a little bit different to the original hair that was in that area before. But usually this is a very minor concern and doesn't bother people. It's just still curly, it just curls in a slightly different direction. So overall, if you do have Afro hair, don't be scared of doing it. You can get good success. I've had very good success with a lot of my patients with Afro hair. It's definitely still a very highly successful procedure, over 99% chances. Just the only things in consideration if you are going for it is make sure you research who is your doctor, who is your team, make sure they know what they're doing when it comes to Afro hair. And really the only way you're going to know is look for before and after pictures, right? Look for proof that they've done what they've done. And maybe you can bring up some of these points that I've mentioned to the surgeon to see if they understand these points as well. Ask them what is different about transplanting Afro hair versus straight hair. If they can give you a nice, good, reasonable answer that's very well thought out, then they probably do know what they're talking about, and you can be fairly well assured that they'll probably do a good procedure for you. If you are interested in getting one done by me, Dr. Chan at Royal Wolf Clinic, then make sure you click the link in the description below. That will take you through to our website where you can book yourself in for a conversation with myself and my team. Have a lovely day, and I'll see you in the next one.